My name is Johannes Thaler from the Medical University of Vienna. At the beginning of the conference, Dr. Jimenez from Madrid presented on an educational session on rebalancing treatments and considerations regarding thrombosis risks in persons with hemophilia. In posters, there was interesting data on a Delphi process reporting on factor dosing in patients with marstacimab and breakthrough bleedings or surgery. There was another interesting poster on the emerging role of rebalancing agents. And in this poster, quantitative interviews were performed and with physicians from US and Europe and their considerations regarding this. In another poster, Dr. Sonkai from Philadelphia compared recombinant factor 11 to marstacimab for prophylaxis of hemophilia B. Dr. Miesbach from Frankfurt reported in an educational center how genetic innovations translate really into improved treatment of persons with hemophilia. Dr. Blatny from Brno will report how von Willebrand care can be improved across lifespan. And Dr. Dreyer from Vienna reported on heavy menstrual bleeding in women with mild to moderate bleeding disorders of unknown cause and investigate the prevalence and risk factors using machine learning. Dr. Chowdhury from University College of London presented on the future of hemophilia care as an area of personalized medicine. And finally, in the late-breaking abstract, Dr. Xu from Wuhan reported on BCMA CAR T cells for the treatment of primary refractory ITP. Besides the numbers of submitted abstracts on the topic of rebalancing agents instead of replacement therapy for persons with hemophilia or bleeding disorders is limited, there was very interesting and innovative data showing how treatment is continuously improved in these patients and how bleeding disorders can get treatment that's more and more personalized to the specific need of these patients.